It's very important, even though you've had a very large operation, to get out of bed and moving again. So with the nurses and making sure that, first of all, we've checked that everything's fine, your blood pressure is fine, will help you sit on the edge of the bed. Often you need to keep your knees together, especially if your thigh's being used. But keeping your knees together and your knees bent helps prevent any stretch on your tummy and will help you sit on the edge of the bed, make sure you feel fine, and just help you transfer into a chair at the side of your bed. You don't need to stand up fully straight, it's just starting to get you moving, and that will help your lungs and your general circulation, and all these things help your healing. And it's a good idea, if you're fine sitting out of bed, to get out of bed 3 times a day for all your meals. And then the other part of the early phase is obviously your shoulders and your arms. Whenever you've had surgery near your shoulder, it will have an impact on how you want to move it. Your shoulder's a very mobile joint. You'll have drains in to begin with. So we just start with just what we call short lever exercises, which is not lifting your elbow above your shoulder. And you repeat these about 5 to 10 times, 3 times a day. And also you can just gently touching your ears, touching your waist, and that just gets your shoulder rotating a little bit. And we encourage you to do this whenever you remember, really, but it's about 3 times a day. Once the drains are out, you can start by using your unaffected arm to help you lift the arm on the side of the surgery. And you'll be aiming to carry these on when you go home. And you should be able to lift your arm fully through all the movements by 6 weeks. If you have any stiffness in your shoulder, 6 weeks post-operatively, you need to go to your general practitioner and get referred for local physiotherapy.
Scars will take about 18 months to sort of settle down, and obviously we advise them with massaging afterwards. For the large operation, it's a very big scar. It runs from hip to hip across the abdomen. There's a scar around the umbilicus, and there'll be a scar on the breast. For the medium operation, the one from the back, there'll be a scar on the back, which if they wear a lot of low-cut dresses and things like that, then the scar will show. Scars will fade, but they go through a period of maturation. It takes about 18 months for them. What we can safely say is how the scars will look at about 18 months is roughly how they will be. Some ladies do actually ask, when will the treatment be finished? And it is difficult because it depends on whether we're have to do any adjustments and if we're adjusting the other breast or not. But it's usually around sort of 18 months will be the time frame that a reconstruction journey will take. But it depends on whether we're having to do any adjustments, or whether we're doing a nipple tattooing. So it can take around 18 months really, and we try to give them that's the time frame, but for what we say is it's a reconstructive journey that they're on, and they can dip in and out.